Okay, Mike Masato, CEO of Staff Driven Dental and the Dental Road Warrior, returning for episode 47 in this series. And today I want to talk about the first day that a new patient arrives in your practice. This is a critical day, and we often blow it and not even know we blow it by the way we handle a new patient coming in for what I call the new patient experience. I'm not going to talk about the entire new patient experience because I couldn't get that in one video. But there are many aspects to the new patient experience, and it should be an experience, so that when a patient comes into your practice, they go, wow, this place is amazing. I can't believe the care and attention they gave me here. It's not like any other place I've gone before, and you blow them away. And this doesn't happen by accident. And it's amazing that how many times that we just book these patients as part of our normal day and put them in any old place in a schedule, and we just kind of run them through. Like we do other patients in our practice. This is a special visit. It needs to be made special. It requires certain level of attention on the patient during that day. A lot of things have to happen on that first day. And one of the things that I came up with many years ago that's critical, that it's called the Doctor Trust Exam. So I want to talk a little bit about the Doctor Trust Exam today because a lot of the new patient experience that I'm seeing, the way that new patients are processed and handled in a practice, have nothing to do with the doctor, which is incredible to me. Who is the patient making an appointment to come see? They are making an appointment to come see the dentist. But the problem is when they get there, they see everybody else and virtually spend no time with the dentist there. And that's a huge deficiency and a huge problem and a blind spot that you have in your practice. This is detrimental. Because the whole idea of getting new patients to come into your practice is what? Retain the new patient. It's one thing to get them in the door and have them show up, and we throw them in the hygiene schedule or throw them with an assistant or throw them with whoever that day, but that's only half the battle. You got to keep them, and they're making a decision whether or not they want to stay and buy from you in your practice right on day one. The old expression, you never have a second chance to make a first impression? Well, that's so true in dental practice. They're coming in deciding, did I find my dental home? Can I get off that, dental carousel of practice to practice? I mean, they're subconsciously thinking that. They're not thinking that actively because, but you see that. You see when patients come in, look at all the dentists they've been to. All right. Then what that means is those a lot of times they're in your practice because somewhere else blew it, and now they're in your office. So let's not blow it by not having a great first impression and great experience. So you have to make time. The most critical thing about the day one is the time they spend with the doctor. It's not how much paperwork they fill out and how much we blow them away by how nice the office looks by a nice little office tour, or they get to meet our wonderful hygienist and our great assistant and all the diagnostic work that we do and treatment against whatever. That's not it. It's the bond they create with the doctor on that day. And that's so important because there are so many fears and concerns affiliated with dentistry, and a lot of them have to be dispelled. And the only way they're going to do that is spending some quality time with the dentist to build what the key point thing, one of the key points of day one. And I think I've said this in earlier videos, that they have to walk out of there on day one trusting you, believing you, and liking you. So let's talk about trust. Trust is a basis for all relationships. All relationships in life are based on trust. You have no relationship without trust. So you have to be able to build trust with the patient, with the doctor. And that's important. And really meeting with the doctor also, the doctor will also empower the staff, that you can entrust the staff as well too. But they should be spending time whenever possible with the doctor first. All right, and not be thrown in the hygiene schedule or thrown in with somebody else, and at the very end maybe the doctor spends a few minutes coming in there doing a quick exam, or whatever. Not enough time. Now I understand how a lot of practices are set up. There are practices out there. This is if you're a clinic and you're seeing 15, 20 new patients a day, and it's or you're one of those companies that are out there, the DSOs are. This may not apply to you. Just get them in and get them out the door. But if you're not one of those conveyor belt kind of practice and you're really looking to, and you're getting 10, 15, 20 new patients a month, you better make sure you spend a lot of time retaining these patients by spending quality time with them, with the doctor. And the only way this is going to happen is if you schedule it appropriately, because the schedule will make or break you. Right? So these people just can't be thrown in any old place. You have to have blocked appointment times for this to happen. And I know a lot of reasons why doctors don't do this is because, I don't have that kind of time to give up on my schedule. Well, what you're really saying is I don't really have time to build my practice and make more money if that's the case, if you put such a little value on new patients. We're so excited that the new patient shows up. This is great. New patients are arriving. We forget they're arriving in the front door and going out the back door. And one of the main reasons why this is happening is the lack of this Dr. Trust exam. So how long should this be? Now, and again, I can't teach the entire procedure on a 10-minute video, and I teach this in my program, and it's in my curriculum, and we teach you how to do this. But you have to block out 20 minutes of quality time. I don't care how you do your whole system right now. Let's say you don't learn this whole system right now. For starters, start blocking out. If you're going to put in like 2 new patients in a day or 3 new patients, 20 quality focused minutes with a patient, because you can do this system in about that period of time. And 20 minutes can seem like an eternity to a patient. It may not sound like a lot of time, but it can seem like a ton of time, because you really get some time to sit down, face to face, knee to knee with the patient. Not over in a chair. Maybe it's in a consult room, could be in a treatment room. Just so that it's not threatening. It's just you're getting to know each other, person to person, to begin to build that trust and bond with a patient. It's a lost art. It's a lost time in these days. It's just gone. So we really need to get back to that, because that really sets the tone for their life in practice right now. They got to walk out of the film, wow, what a great guy, or what a great woman. She really cares about me. I can really trust her. I really believe in what she's recommending here. Because, a lot of times we're meeting this patient for the first time and we're already selling them something. And when's the last time you bought something from someone you didn't trust or had no trust with yet, all right, and bond with yet? You're not going to do it. So let's not skip this important part of spending 20 minutes of focused time talking. Now you're like, what am I saying 20 minutes? Well, great. I give that all to you. There's a whole procedure, step by step, of what to do during this time. But one of the parts of the procedure is sitting down with them, talking to them. You have their intake, going over their intake with them and discussing their fears and concerns about dentistry, their likes and dislikes, what their objectives are. Learning about them, getting them talking. Because the more they're talking on that first day, the more you're winning. The less they're talking, the more you're losing. We like to hear ourselves yap in our practice about how great we are and how wonderful we are, and everybody's talking to them about everything, and we hardly let the patient open up their mouth. You got to get them talking. And that's why the questions you ask during the Dr. Trust exam gets them talking. And then they get to learn about you. Not just about how great a dentist you are, but a little bit about your philosophy on dentistry, what you're all about. What do you believe in terms of treatment and healthcare, and how you approach your patients, and all those, setting expectations and all these different things. They get to develop that sitting down talking with you. All right, and that's why I give guideline questions and laying this all out of how to go do this whole thing. So this is the non-clinical part of the visit. It's the relationship building part of the visit that's gone by the boards. Right? And 2-3 minutes in a chair when you walk in after they met everybody else, or on the fly, or to do an exam, or is not enough. Not enough. You want to retain patients, right? So you really have to fix your thinking here about building in time to do this Dr. Trust exam with patients, building this quality 20 minutes of time, of bonding time, with the patient. Right? And so, because this is all going toward retention, and then by trusting you, they can start believing you. They'll start believing what comes out of your mouth and liking you, which is the other key component on day. Don't discount liking, how important it is for them to like you by the time they leave there, because that's half the battle. They don't find out how great you are with your dentistry till later. So that's a key human element to put in place right there. And that's something we have to get back, because this will separate you out, from everybody else that's out there right now that are just getting people in on and pushing them through and just getting dentistry. This is not just about getting dentistry. This is about building relationships with people, long-lasting relationships. Ask yourself about your most valuable patients. The most valuable patients you have are the ones that you have a long-term lasting relationship. They keep coming back year in and year out to get treatment in your practice. Those are the most valuable patients you have, as opposed to the ones that have come, one and done, in and out the door. These emergency patients that just show up and they're gone. Why? There's no bond. There's no trust there. And there's no foundation, there's no relationship there. And you build great relationships with your patients, what happens? You start getting more referrals, all right? And this is great. That's the great thing about dentistry. People keep coming back, and that's the whole thing. And if you have better retention, the less money you have to pump into marketing to continue to make ends meet, all right? So it's a whole snowball process here that starts at the beginning. And there's an old expression that I said many times before: take care of the beginning, and the end will take care of itself. So you have a lot less problems later on with patient retention and everything if you basically do this from day one. All right. So again, Dr. Trust exam, It's critical. Again, couldn't do all the steps there on a little video, but if you want to learn more, there's ways to learn more. Just seek me out. We'll be more than happy to teach you the procedure for this, and it's a very powerful procedure in terms of building bonds and trust and lasting patient relationships in your practice and better retention as a result. All right. Well, thanks for watching. Hope you enjoyed it, and I'll be back before you know with another episode. Again, please remember to share and let people know about the series. Thanks so much.